People hear rhinoplasty and usually think of bruising and swelling, but recovery actually depends a lot on what kind of rhinoplasty you had. Not all rhinoplasties are the same. It really depends on what your goals are and what your anatomy is. Have you had previous surgery before? Is this solely for functional reasons, for cosmetic reasons? Involve just the tip, the bridge, what techniques the surgeon uses. So the recovery is not the same for every patient. Cosmetic versus functional versus a mixed cosmetic and functional, in addition to revision patients, all recover differently. Social media often oversimplifies the recovery process. Most patients actually recover more comfortably than they expect. Usually the first day or two is a little bit rough, and beyond that, it really is more annoying than painful for most patients, and more of an annoyance until they get the cast off, the suture splints out, etc. The timeline usually surprises patients more than does the pain, and by that I mean they think they have an idea of how long the recovery will take. They also think they have an idea of how painful it'll be. Usually they're underwhelmed by the pain, but surprised at the length of time it takes to achieve the final result. Doesn't mean that it's bad for a long time. It just means that it takes a long time for it to slowly get better until you achieve that final result. So I usually tell patients that when they ask about recovery, it kind of depends on what you mean. There's the acute phase where it's a little painful, puffy, harder to breathe. There's the slower phase where you get your cast off and it looks pretty good, but it's still not done by any means. And so I tell patients usually it looks reasonable at 2 to 4 weeks. At a month, I'll start talking to you about how it looks, but we're going to keep talking to you about it for at least a year. I always tell patients that recovery is a process, not a single moment when suddenly everything looks perfect. My name is Dr. Colin Pero. I'm a facial plastic surgeon in Dallas, Texas. I specialize in rhinoplasty and facial cosmetic surgery. In this video, I'm going to walk you through what rhinoplasty recovery is actually like, including the different types of rhinoplasty, what the first few weeks feel like, and some of the things that patients are most surprised by after surgery. First, it helps to understand that there are several different kinds of rhinoplasty procedures. Primary cosmetic rhinoplasty. This is what most people think of when they think of nose job. Some of those common elements of primary cosmetic rhinoplasty are reducing a dorsal hump or a bump on the bridge, refinement of the tip, whether it be a disproportionate size to the tip, roundness, over-projected, sticking out too far, drooping, etc. It also helps in achieving facial symmetry, straightening the nose itself and how it balances with the remainder of the face. Typically, this is an elective cosmetic surgery, one that's not being done for an emergency or after an acute injury. Typically, patients undergoing this procedure have the most predictable recovery path. You can expect some mild swelling and or bruising, with most patients going back to full-time jobs at 7 to 10 days, up to 2 weeks in some cases. Functional rhinoplasty, septorhinoplasty. Some patients are much more focused on breathing than appearance. For patients with a functional nasal obstruction, it can involve one or several different areas of the nose causing the obstruction. Probably the most famous and most common is a deviated septum, which is the wall on the inside of the nose being pushed to one side or the other. The question is really, is it pushed far enough to obstruct your breathing? In combination with that, sometimes the side walls of the nose will collapse inward. Where the septum and the outside wall of the nose meet, it forms the nasal valve. If that collapses, that can cause your breathing as well. So that is by effectively pushing your nose in from the outside. Additionally, some people have had previous trauma that causes some of these problems to disrupt the nasal bones inward, narrowing their breathing. And lastly, the turbinates are a structure inside the nose that can swell and cause obstruction at the same time. Often, the cosmetic and the functional goals overlap. For instance, if the nasal bones have been broken and pushed inward, that can narrow your nasal valve and block your breathing. Similarly, if your septum is deviated to that side, well, then all of those really are contributing to your obstruction. So often, the correction of the function and the correction of the cosmetic aspect overlap. When operating on the inside of the nose for breathing reasons, then the recovery often is actually somewhat prolonged or more significant because now you have more internal swelling where we address the airway initially. Typically, the breathing is noted by patients to be pretty good over the first day or so, but then it worsens because swelling peaks over the first 48 to 72 hours and then slowly gets better. We usually see our patients back on day 6 or 7 after surgery, and at that point, when we remove the external cast, any internal splints, do some suctioning, their breathing rapidly improves thereafter. Revision rhinoplasty. This is usually the most complex category. The keys that make revision rhinoplasty different from primary rhinoplasty is just the fact that you've had surgery before. And without knowing exactly what happened in the previous surgery, you can't count on normal anatomy. So there's a process of figuring out what's wrong before you can figure out how to correct it during the surgery. Now, most experienced rhinoplasty surgeons have a pretty good idea of what to expect just based on your physical exam, but you don't know for sure until you get in there. So really, you have to be prepared to reconstruct any of the areas of the nose that might have been disrupted or causing the problem, be it functional or cosmetic. Because there has been previous surgery, there's been disruption to blood vessels as well as lymphatics, which can affect swelling after surgery. So pretty typically, revision rhinoplasty patients are going to have more swelling than a primary rhinoplasty patient undergoing a similar surgery. That being said, sometimes revision rhinoplasty patients don't need a complex revision. They just need to address one certain area of the nose that was the problem after the first surgery. So they might actually have an easier recovery than someone with a more difficult primary rhinoplasty. That being said, in general, revision rhinoplasty patients are going to have a little bit longer recovery period before they do finally achieve that final outcome. Reconstructive/trauma rhinoplasty. This is done after injury or significant structural problems. So the nose is a pretty unique structure. If you think about it, you've got skin on the outside, middle layer is kind of bones and cartilage in general, and on the inside you've got mucous membrane. So if you impact something from the outside, let's say you break your nose, it's going to push in from the outside, but internally it's pushing on the inside as well. So that can affect your breathing on the inside as well as the cosmetic appearance on the outside. So especially in post-traumatic cases, you really have to think about both aspects when correcting the deformity and correcting the function. This often results in collapse, either in the nasal bone, which is the hard part in the upper third of the nose, or in the lower half to 2/3 of the nose with the cartilages of the nose that can often collapse over time. Sometimes this is a result of trauma. Sometimes it's a result of just genetics and the way you're born and or aging changes with the nose. Sometimes it's due to previous surgery. Anything that causes the nose to collapse inward or to deviate will change the internal shape of the nose as well, affecting your breathing as well as the external appearance. To fully correct this, you have to restore both the form and the function as they go hand in hand. So the recovery for this is really highly individualized. It depends on the complexity of the issues at hand, what is required to reconstruct them, any previous surgery, how severe the previous trauma was, if there are any normal structures that are no longer normal or are even missing. Grafting. Patients often have questions about the need for additional cartilage or other materials during rhinoplasty. For most modern surgeons using modern techniques, including preservation rhinoplasty techniques, the need for additional cartilage has lessened quite a bit over the last several years. That being said, there are some typical cases in which additional cartilage is necessary to adequately reconstruct either the functional or the cosmetic aspect of your nose. Typical reasons that we might need additional cartilage, the most common is that you've had a previous nasal surgery. That might have just been for function, like a septoplasty, or it could have been a previous septorhinoplasty, rhinoplasty, broken nose surgery, or you might have had another injury that might have led to something like a septal perforation, which is a hole in your septum. Typically, the need for additional cartilage comes in cases where there's been a previous surgery on the nose. Either that's a functional surgery, just like a septoplasty, or a combination cosmetic and functional surgery, or just even a cosmetic rhinoplasty before. Sometimes part of the septal cartilage is missing due to either an injury, previous medication abuse, or other reasons, including picking, that result in a hole in your septum, like a septal perforation. Well, if there's a hole in your septum, then we know there's no cartilage there. So we need cartilage to adequately reconstruct certain parts of the nose. So in those cases, whether we know or we find out during surgery that there's not adequate cartilage, we need to find it from somewhere else. The somewhere else's include your ear, your rib, or somebody else's ear or rib. It sounds like a joke, but it's true. Sometimes we use cadaveric cartilage, which has been donated to science, been radiated to make sure that it's safe. And we will sometimes use that to help reconstruct parts of the nose if there's not adequate cartilage, or if the surgeon isn't comfortable with ear cartilage or rib cartilage grafting. In my practice, I pretty much exclusively use autologous cartilage, which means that comes from yourself. Many surgeons are comfortable using cadaveric cartilage or autologous cartilage. I find in my practice that autologous cartilage is more predictable, less likely to fail over time. And it really just depends on how much cartilage you need, what the shape and consistency of the cartilage needs to be when deciding between ear cartilage or rib cartilage. As you can see, ear cartilage is pretty flexible and curvy, whereas rib cartilage is pretty stiff and straight, and it's hard to tell where the bone ends and the cartilage begins. So if you need stiffer, straighter cartilage that you could cut thinner, then usually rib is going to be a better choice. Autologous cartilage is used by a lot of surgeons, and we've come to understand that if being used in certain places of the nose, it has a higher risk for failure than others. As long as your surgeon is well versed in this, it can be an acceptable alternative. In my practice, I do a lot of revision rhinoplasty. And so typically when I'm doing revision rhinoplasty, that's when I'm going to encounter any artificial materials. These can include things like silicone, medpore. There are a number of other materials used, especially overseas. In rhinoplasty patients, especially In Asia, they're pretty common, where the augmentation rhinoplasty to raise the bridge and or the tip is a common goal. Then these are quick and easy alternatives to a more traditional rhinoplasty. In most patients, artificial materials don't cause any problems. However, when they do cause complications, they can be catastrophic, including extruding out through the nose, causing infections, needing reconstruction, including using your own rib cartilage, etc. For that reason, I choose not to use any artificial materials in my rhinoplasty patients. What the first week is really like. So what does recovery actually feel like during the first week? I think the biggest question, especially patients who've never had surgery at all, is it painful? It's reasonable to consider this. I'm not going to tell anybody it's painless, but it's usually not as bad as you might think. I tell most of my patients that the first day is not bad. Days 2 through 4 are kind of where the peak of the swelling happens. And so that's when it's the most uncomfortable. Think of it more as annoying than excruciating. It's not something that you're super happy about, but it's also not miserable. Bruising is variable in patients. Depends on what techniques are being used and where the changes in the nose are happening. The more work done on the bones of the nose typically increases the bruising. There are certain factors genetically that make you more or less likely to bruise as well. And then the techniques of the surgeon can affect the bruising as well. We utilize a piezotome, which is like an ultrasonic scalpel that can cut through the bone as opposed to using the traditional hammer and chisel. And so that's typically much less traumatic to the patients and typically results in much less bruising, if any. Typically, I'll tell patients they have a 50-50 chance of having any bruising at all. And if it does occur, then it usually resolves by 7 or 10 days. Taking things like bromelain, which is an extract from pineapple, as well as an herbal supplement, Arnica montana, can help lessen the severity and duration of the bruising. So we usually recommend our patients take that starting even before surgery through the end of any bruising if they see it. If by day 3 or 4 they don't see any, they're probably not going to have any bruising and they can stop the supplement at that point if they wish. There is some improvement with swelling as well. So until that is resolved to an acceptable level, a lot of times they'll stay on it until that. Nasal packing and nasal splints are very different things. The splints I use go inside your nose, on your septum, sandwiching the septum in place, preventing it from swelling too much or moving around during that initial 6-day recovery period until they come out. Now, TikTok is full of pretty scary videos of splints coming out. Typically, the ones we use are much smaller and much thinner and much less dramatic. The splints I use are 1/4 of a millimeter in thickness. As long as they stay clean, you hopefully will be able to breathe around them. Now, again, swelling peaks at 2 to 4 days, so that's when you're the stuffiest. But as long as you rinse with some saline to keep the dried blood and mucus out of there, you typically can breathe somewhat through your nose during the initial recovery period. What surprises patients most? It's variable. I think for some patients, it's how stuffy they feel on day 2 compared to day 1, because it typically gets worse after the first day. But then it's mostly what the recovery is like after the first week that surprises them. They expect that it will get pretty good pretty fast, but then they're surprised at how long that last little bit of improvement takes to completely resolve. Most people are surprised at how much congestion there is in those days 2 through 4, but there are things you can do to help. 1, start watching your salt intake prior to surgery. If you limit your sodium intake to less than 1,800 milligrams or even less than that per day, can make a big difference in how swollen you are both internally and externally during and after that first week of surgery. Sleeping a little bit elevated, just get your nose higher than your heart. You don't have to sit straight up, but get your nose higher than your heart to let gravity help you. That makes a big difference as far as how much swelling you get after surgery. If you continue to clean and rinse your nose, the saline like we instruct you to, it'll help keep things clean to help minimize the congestion in your nose. But yes, you can have some mouth breathing. So using a humidifier in the bedroom can sometimes be helpful to make that be a little less bothersome. Most of the swelling and the bruising resolves somewhere in the day 7 to 10 range, but there's a continuous slow amount of swelling that takes a long time to go away and just gradually gets better. I tell patients in general, there's a steady decline of the swelling over time, but there are little bumps in the road. If you go eat a bunch of soy sauce or Mexican food, you're going to notice that your tip's a little swollen, whether that's at a month after surgery or 3 months after surgery. Obviously, it's less so at 3 months than it was at a month, but the same trend of ups and downs you notice with a general decrease over weeks to months, even up to a year. The first week is usually the most inconvenient part, not necessarily the most painful part. Week by week recovery timeline, week 1. What's happening during the first week? Well, during the first week, you have the initial swelling from the trauma of the actual surgery, bruising, if any, that sets in as well. And so there's a gradual increase from the time the surgery ends over the first 24 hours, where it's usually pretty tolerable. And then by 48 hours or so, it's a lot more noticeable. So between 48 and 72 hours. 2 to 3 days after surgery, that's typically when it peaks and gets better again. For instance, if we do surgery on a Thursday, I tell patients you've got to get through the weekend and then you'll start to turn the corner. We typically see our patients back on day 6 or 7. And at that point, that's when the cast, the sutures, the splints are all removed and the swelling is abating enough that they really feel like they're turning a corner. Key points for after surgery are to minimize heavy lifting, heart rate increases, keep your head elevated, watch your salt intake, and stay somewhat active. If you just lay around all day, it makes it pretty miserable at night whenever you're just laying there thinking about your nose. So no, I don't want you lifting heavy stuff. I don't want you bending over straining, but I want you to kind of be moving around and have somewhat of a normal day activity level wise without straining, heart rate increases, etc. Weeks 2 through 4. What changes after the cast comes off? Well, most people undergoing rhinoplasty are doing it for a reason. So there's something they don't like either about the appearance of their nose or their breathing or both. So typically, once the cast comes off and the splints, if any, from the inside of the nose come out, things are better. So the bump might still be there to some degree because it's still swollen and the skin is still the same shape. That's going to contract down over time. The tip might still be a little bit larger than they like because it's swollen. That's going to go down over time. But in general, if there was some straightening of the nose, that's readily apparent. Improvements in the bridge, improvements of the tip projection or rotation, so inward or outward and up or down, are readily apparent. They're not complete, obviously, at a week, but they start to get better over the next 2 to 3 weeks. I typically tell patients it's going to look pretty good between 2 and 4 weeks. Using some of the newer techniques, including preservation techniques, we're able to increase the recovery time and speed it up so where it's closer to 2 weeks than 4 weeks for each patient. But your own individual activity level, following directions, watching your salt intake, and then just your general anatomy and what we had to do with surgery is variable between different patients. So count on some variability there and some ups and downs as long as the general progress is steady. In my practice, I tell patients I don't want you to exert yourself, bend over, lift heavy objects, get your heart rate up for a minimum of 3 weeks. At 3 weeks, I'm typically comfortable with you starting to do a little bit of activity, but don't think about doing any kind of normal exercise for at least 6 weeks after surgery, and definitely nothing where you have a risk of impact to the nose itself. Keep in mind, your nose is still healing externally as well as internally. So some of the persistent congestion can be there through this period, but it gradually gets better, as does the appearance of the nose externally. Months 1 through 3. This is where patients often become impatient. So I usually tell patients that at a month, it's looking pretty good, and that's when we'll start talking about what it looks like. And I say it that way, as in start talking about it, because at that point, it's starting to resemble its final shape, but it's going to take a long time before we get there. Usually by 3 months, which is in my practice is the first time we take pictures, you've got a reasonable expectation of what it's going to look like that you can extrapolate what the next 9 months will look like. However, it's going to take 9 months more to get to that final product. So at 3 months, it's looking pretty good, but you've still got a long way to go. In retrospect, most patients, when they get to a year, thought they were done at 3 months, but realized they weren't anywhere close. In general, the refinement happens from the top down. So the bridge typically has thinner skin, so that is going to thin out earlier, and the tip is going to hold more swelling because that's lower down on the nose, and that takes longer to get some of the subtle shadowing and refinement to occur. Small asymmetries will happen throughout time. One side might look a little fuller than the other side, and the next time I see a patient back, it's back to normal, or the other side may look a little fuller because the swelling will fluctuate back and forth between the sides. 6 to 12 months, when do patients see the final result? The famous rhinoplasty surgeon once said that the rhinoplasty patient may change for the rest of their life. That being said, in my practice, I tell patients that it may change, but the majority of that change is going to be done by a year. That depends. In some patients, especially in thicker skin patients that have had revisions or multiple revisions, it may take even longer than that to see that final result. Typically, most of the subtle changes occurring between 6 and 12 months and beyond are happening in the lower third of the nose and the tip, the sidewalls of the nose, and the shape of the nostrils. Thick skin patients present a challenge that their recovery timeline is much longer. Often for these patients, we'll put them on a preoperative skincare plan and a postoperative skincare plan, sometimes even including Accutane to help thin the skin, depending on the severity of it. We sometimes will see thick skin patients improving steadily and then actually worsen between 3 to 9 months because the skin inflammatory disease, especially in patients with rosacea, which causes thicker skin sometimes, can actually get worse after surgery. In those cases, working hand in hand with your dermatologist to help thin the skin out to achieve the best result we can is imperative. It's important to remember that a rhinoplasty matures gradually. Biggest misconceptions about rhinoplasty recovery. What do patients typically misunderstand about rhinoplasty recovery? I think social media is a blessing and a curse sometimes. I think sometimes when patients see other patients on the table photos, it can be misleading as to what their final result will look like. Typically, the final result is not visible even on the table at the time of surgery. It's not visible 1 week after surgery. It often isn't visible for several months to a year or later in some patients, depending on their issues. Things change over time, and you really have to have the trust of your surgeon to make the best judgments for what is best for you in your case that will give you your best recovery, best outcome for the rest of your life, much more so than what it looks like at 2 to 4 weeks after surgery. Swelling is uneven. It doesn't all go down at the same pace in your nose, doesn't all go down at the same pace for different people's noses. So you have to be in it for the long haul. So I tell patients, we're going to get to know each other. I'm going to see you for a year. And I hope that a lot of our visits are just silly about the cruise you went on and because your nose looks fine and you're doing okay. But I might see you 3 months later and realize that something's not on the timeline we want it to be. And there's little things we'll do, little interventions to help get you back as close to that timeline as we possibly can. In general, we're able to avoid going back to surgery to correcting that stuff by doing these little minor interventions early. Just like the external appearance is going to take some time to improve, sometimes the breathing improves slowly over time as well. Just because something's swollen on the outside, it's probably swollen on the inside too. So as that goes down over time, a similar timeline to the outside appearance, then that could gradually improve to where sometimes patients have a little bit of persistent nasal obstruction at 3 months, and by 6 or 9 months, it's resolved. One thing unique in plastic surgery with the rhinoplasty patient is you and everyone else can see your nose. And so the emotional journey that is attached to that can be tough. So you've got to be understanding that this is going to take some time to achieve your final result. And sometimes rushing it by doing something like excessive steroid injections, aggressive taping, sometimes can actually cause more problems than if you just let the process continue naturally. Just like any other aspect of social media, if you try to compare your recovery to somebody else's recovery online, if it doesn't completely follow this one example you find, it doesn't mean something's going wrong. So don't compare yourself to somebody else online. Talk to your surgeon about your concerns. You should feel comfortable that they have reasonable expectations and a plan to address them if anything needs to be done. Changing the appearance of your nose, changing the appearance of your face in general can be emotional and a psychological adjustment. For some patients, it's difficult in the first week or even 1 month visit, and I'll see them back at 3 months, and that's when they're really starting to turn the corner and really identify with their new nose. In most patients, I would say they actually begin to look at their old self or their old pictures, and that looks strange to them more so than their new pictures. It's different for different patients. I've seen it last up to a year, but most patients, somewhere in that 1 to 3 month range, they're really starting to turn that corner and be really excited about their future. Recovery is rarely perfectly linear. Who's a good rhinoplasty candidate? So who tends to do well with rhinoplasty? I think the most important thing in rhinoplasty candidates is realistic expectations. That's partly your job, but it's partly my job. I need to give you realistic expectations as to what to anticipate going forward through the recovery process. And that starts at our preoperative consultation. On every single one of my rhinoplasty patients, we take photographs and show you on the computer what our expected goals are to achieve with surgery. I need to have that conversation with you. So I take up to an hour with all of my new patients to make sure that we have reasonable expectations together. If you want something that anatomically is not possible for your nose or doesn't fit your face, it's possible that we may not be a fit for each other because I just don't want to give you an unrealistic expectation about what's achievable. As we go through the preoperative consultation process, it's important that we have clear goals, both for your breathing as well as for the cosmetic appearance of your nose after surgery. I want you to understand the process of the surgery itself, the recovery timeline, and what to expect at different steps along the way of recovery. It's important that we address both functional and cosmetic concerns during surgery. Sometimes it's required to actually make changes that patients don't anticipate. Sometimes they don't realize that they have collapse on the sidewalls of the nose, and that's why their nose looks pinched. And the last thing they want to do is have a bigger nose. But if it's a different shape, they may anticipate that as bigger, but it's actually going to be much more functional and often more cosmetically appealing. Now, by showing them in the mirror on their own nose as well as their photographs, the imaging changes that we're going to make with the surgery, a lot of times we help them understand that. Patients have to be patient. It's just part of the process. It takes months and months for this to be kind of finalized, and most of the changes happen early, but they happen on different timelines. So if you come in with one expectation of when things are going to look a certain way and it doesn't happen that way, you have to be okay with listening to your surgeon and working with them without resorting to anything drastic, such as revision surgery too early, too many steroid injections, which have risks of their own, et cetera, in order to achieve the goal sooner, which may harm your long-term outcome. The best rhinoplasty patients aren't chasing perfection. They're looking for balance and harmony. I really try to stress to patients that not all noses look the same on different people's faces. So yes, I like to look at inspo pics and see what your preferences are as far as appearance goes. But in general, refining what you have is typically a better approach than trying to do a drastic change on your nose. Even if it's anatomically possible, a lot of times it's more upsetting to patients psychologically, and it's off-putting to to the casual observer because it doesn't quite fit with your other facial features. So going through the computer imaging process and the preoperative consultation is really crucial to help understand that. If you're considering rhinoplasty and want to learn more about your options, you can visit my website to schedule a consultation, including virtual consultations for patients outside the Dallas area. My team and I are always happy to help guide patients through the process and answer questions about whether rhinoplasty is the right fit for them. And if you found this video helpful, make sure to subscribe so we can continue making educational content about facial plastic surgery, recovery, and what patients can realistically expect throughout the process. See you on the next video.